We are part of the vet community of Singapore, and we provide the service to the vets as well. But we're not competing with the family vets, this is what I'm saying.
I think it's very important to state that we are an extension of the service of the general practitioner, for cases that they struggle with, or they need some advice, or they need us to do a bit more investigation, or something more complex that they may not be set up to deal with.
It's a bit like yourself, you have headaches for a long time, so your GP is going to send you to the neurologist to find out if you don't have something wrong with your brain, but you wouldn't see the neurologist by yourself without talking to the GP first. Dog with slip discs, and they get paralyzed from that, and it can be a very satisfying sort of case for us, because we do the surgery and the results can be very concrete after that. The dog may be able to walk, sometimes within days, sometimes within weeks, but yeah, when we see the dog walking again, we're very happy. When pets are doing better, it's satisfying. Yeah.
The cases that we are always happy are the ones that of course do well and they go home and the owners are happy. Sometimes you will get cards for a year later and say that, oh, thank you, my pet is still doing well. And sometimes I feel that we forget, because we might have done a surgery 5 months ago and we've forgotten all about the patient, to be honest. And then the owners will pop in and say, oh, do you remember my dog that you've done surgery on? Things like that helps to keep us going, and it's knowing that we have made a difference to one pet, and sometimes we forget that this pet might be the world to the owner, and our perspective do not reflect what is their perspective, and sometimes this might mean a lot to them. Yeah. Towards the end of life, unfortunately, is something that every pet owner will probably have to experience. And we need to help prepare owners about what they can use to define as a quality of life. And there are scales that can be used to help define a pet or animal's quality of life. And if we find that they are actually not faring well, or they're doing badly in terms of the quality of life, then I think unfortunately we need to start thinking about sometimes the more humane things of doing things. Like sometimes we would have to unfortunately put them to sleep. For us, of course, our role is to provide guidance, and a lot of owners will look to us for guidance. So I think it's a combination of that, giving them information and also our opinions as well to help them make that very difficult decision. At the end of the day, I think we are here to make the decision with them.
It's a bit taxing emotionally, because I believe that we must be emotionally involved. We also have pets, our own pets, kids, family members. At the end of the day, what's most important is the pet. We're in front of a patient, we're trying to save them if we can. If we cannot, to make them not feel the pain anymore. And then we extend this sort of empathy to the client, because we appreciate that the patient in front of us is a sort of a family member. And so when we're having the conversation with the client, we take that into account. At the same time, as vets, we must uphold we have sort of an ethical code, and when we find that the pets are suffering too much, or we're reaching a dead end, even so they're not suffering, but we are hitting a wall, like there's a disease that we cannot treat, we must have a difficult conversation with the owner.